Parkinson's disease, PD, is a chronic, progressive neurological disorder that primarily affects movement but can also influence mood, cognition, and various bodily functions. It results from the gradual degeneration of nerve cells in a region of the brain known as the substantia nigra, which plays a vital role in controlling movement. These nerve cells produce dopamine, a chemical messenger that enables smooth, coordinated muscle activity. When dopamine levels drop significantly due to cell death, the brain loses its ability to regulate movement effectively, leading to the characteristic symptoms of Parkinson's disease. Causes and underlying mechanisms. The exact cause of Parkinson's disease remains unknown, but researchers believe it arises from a combination of genetic, environmental, and age-related factors. Although most cases are not inherited, some genetic mutations can increase the risk. Environmental exposures such as pesticides, certain chemicals, and heavy metals are thought to contribute in some cases. Age is the strongest risk factor, with Parkinson's most commonly appearing in individuals over 60. However, young-onset Parkinson's can occur before age 50. Inside the brains of people with Parkinson's, scientists observe the presence of Lewy bodies, abnormal protein clumps containing alpha-synuclein. These deposits disturb normal cell function and eventually trigger cell death. As dopamine-producing neurons decline, the brain's circuits controlling movement become less efficient and more erratic. Primary motor symptoms. Parkinson's disease is best known for its motor symptoms, which usually start gradually and worsen over time. Tremor, the most recognizable symptom, often beginning in one hand. It typically occurs at rest and may lessen during purposeful movement. The pill-rolling tremor where the thumb and index finger rub together is a classic sign. Bradykinesia, this term means slowness of movement. Simple tasks such as buttoning a shirt, writing, or walking may become slower and more difficult. Bradykinesia also affects facial expression, resulting in a mask-like appearance. Rigidity, muscle stiffness in the limbs and trunk can limit range of motion and cause discomfort or pain. This rigidity contributes to difficulty performing daily tasks. Postural instability, as the disease progresses, individuals may have problems with balance and coordination, increasing the risk of falls. Reflexes become weaker, and maintaining an upright posture becomes harder. Not everyone experiences all four symptoms, and their intensity can vary widely. Non-motor symptoms. Beyond movement problems, Parkinson's disease includes many non-motor symptoms that can appear early or later in the disease. Sleep disturbances, these include insomnia, restless sleep, and REM sleep behavior disorder, where individuals physically act out dreams. Cognitive changes, slowed thinking, trouble concentrating, and memory issues may occur. In later stages, some patients develop dementia. Mood disorders, depression, anxiety, and apathy are common and may arise before motor symptoms appear. Autonomic dysfunction, Parkinson's can affect involuntary bodily functions, leading to constipation, low blood pressure, bladder difficulties, and excessive sweating. Loss of smell, a reduced sense of smell, anosmia, is an early sign and often precedes diagnosis by years. Speech and swallowing problems, speech may become softer, monotone, or slurred, and swallowing difficulties can appear in advanced stages. These symptoms contribute significantly to the overall impact of the disease. Diagnosis. There is no single test to diagnose Parkinson's disease. Doctors rely on medical history, neurological examination, and observation of symptoms. The response to dopaminergic medications like levodopa also helps confirm the diagnosis. Brain imaging, such as MRI or CT scan, may assist in ruling out other conditions. Treatment and management. Although there is no cure for Parkinson's disease, several treatments can greatly improve quality of life. Medications. Levodopa is the most effective drug and restores dopamine levels. Dopamine agonists mimic dopamine's effect. MAO-B inhibitors help preserve existing dopamine. Other medications target specific symptoms like tremor or stiffness. Deep brain stimulation, DBS. A surgical procedure where electrodes are implanted in specific brain areas to regulate abnormal signals. It can be highly effective for reducing motor symptoms when medications become less reliable. Physical and occupational therapy. Exercise improves balance, strength, and mobility. Therapists help patients maintain independence and adapt daily activities. Lifestyle approaches. Regular physical activity, a balanced diet, adequate sleep, and stress management all support overall well-being. Progression and outlook. Parkinson's disease progresses slowly and differently for each person. While it is not fatal, complications such as falls, infections, or swallowing difficulties can pose risks. With modern treatments, many individuals live long, fulfilling lives despite the challenges. Parkinson's disease remains an active area of research, with scientists exploring new medications, gene therapies, and regenerative approaches to slow or reverse the condition. Understanding its symptoms, causes, and treatment options empowers patients and families to manage the disease effectively and maintain a meaningful quality of life.